Hi, this is Jeremy with Tulsa Senior Compass, and I'm so excited today to have a very special guest, an expert in the senior care community. And we're going to go over some really important questions that you or your family are probably already asking yourself, and you don't really maybe know the answer, or maybe you have some ideas, maybe you think you know the answer. But we're going to go over some questions when it comes to senior care. What do I do for senior care? How do I help my family? When's the right time to get somebody in here? And what kind of care do I need? So we're going to go over some of those questions today. But before we get into that, my name is Jeremy, and I am the owner of A Better Solution in Home Care here in Tulsa, Oklahoma, out of the Bigsby area, and we serve the entire Tulsa metro area. So a little bit about me. I've been in the senior care industry for several years, working with seniors and senior care companies across the United States. And we also own a senior care company right here in Tulsa, Oklahoma. So enough about me. Let's jump into the episode.
Yeah.
So,
Yeah. I'm
Gus,
Gus. Yeah. I'm
thank
Gus
you
Torres.
for
Oh, sorry.
coming up.
All right.
So
All right.
let me lead the that way. It's a little bit more
Okay.
because I did a cut there and I'm just pausing.
Okay.
So then I'll intro you.
Okay.
Okay. So let's do another pause. All right. So Gus, would you please introduce yourself, who you are, what you do, and just share a little bit about your expertise?
Yeah. I'm Gus Torres. I'm the owner of A Better Solution Home Care also here in Wichita, Kansas. Been in business for 10 years serving this community. Really love what I do. I'm a fan of home care. I'm not just an owner, I'm a fan of home care. So anything home care related, I just love. Yeah.
Awesome, awesome. So you got one of those big signs like, "Hey, I love home care. I love home care."
Yeah. Definitely love what I do, which is
Awesome.
which is pretty cool.
Yeah, I've seen you interact with a lot of people over there in Wichita, and you definitely have a passion for what you do. I've seen you at industry conferences throughout the United States. People really look up to you and your insight. So I appreciate you being on the podcast today and really sharing your expertise. I think a lot of families are going to get a lot out of this.
Yeah. Thanks, Jeremy. I appreciate that.
So let's jump into it, Gus, if you don't mind. I've got a question for you, and let's just get straight to the bones of the state. Let's just dive in. When families first call you, like, what's the biggest misconception they have about home care versus home health?
Yeah, that's a great question, a great lead question. The main misconception that they have is that they don't know that they're different things. They don't know that home care does one thing and home health does another. So most of the time when we do get calls, there's an educational process to our introduction, and trying to get them aligned with what their needs really are. So making sure that we ask the right questions and really finding out what they need is important. But yeah, them not knowing that home health is different than home care, and thinking that they're all combined.
Hmm. Yeah, that's really good. I think some people assume because they've seen nurses, right, on TV and different shows, they think I'm going to get a nurse for my mom and dad or myself, right? And that's what I need. So I need to get something like that. And some of them probably don't even know home health term versus say home care term, right? Some of them might think nurses or I need a nurse to come to my home. So can you speak a little bit about what is home health? What is that?
Yeah, home health is kind of focused on maybe like an episode that somebody's having, um, where with doctor's orders, they can get nursing and different types of specialists or therapists to their home to help them get better from a specific episode. So if they fall and break their hip, they get discharged from a rehab, and then they're sent home, they could get some physical therapy within their home um, for this specific injury or or ailment that they're going through.
Mm.
So that's kind of home health. Um, I want,
And
don't
so
want,
some of those might be like medication administration, maybe wound care is very common with home health. I know that my mom, one of the reasons why I got into home care, my mom, she had end-stage renal failure, she had end-stage congestive heart failure, and she did have to have, she had wounds on her legs, because water would be building up.
Yeah.
And so she was admitted to the hospital. The hospital did what they could, but then they sent her home, and they prescribed a home health nurse, an RN, to come out once a week to change her wounds on her legs, right? But I at that time I was like, this is a long time ago, right? I was like, oh, can you also help? Maybe my mom had some diapers. Can you help? I'm working other businesses. I'm helping my family. I've got kids, right? Can you help with maybe taking care of some of those things? And the nurse RN politely declined and said, I'm sorry, I can only change the wounds. And so I was left with the question, well, okay, well, if home health doesn't take care of hygiene or helping with diaper changes or something like that, then what is it? So can you talk a little bit about that?
Yeah, so you're talking about the home care and the home care part of it, and where home health is just working for a specific cause and getting better for that cause. Home care could do a lot more. So basically, home health may come in 2 to 3 times a week for 45 minutes to an hour to work on some therapies or wounds, or helping them, with their diagnosis, where home care could come in, 24 hours a day, and do all the other stuff. We call them ADLs, activities of daily living, the things that you need to do to function throughout the day besides the medical needs, right? So you're looking at maybe some light housekeeping, some cooking, ambulatory care, walking throughout the house, bathing assistance, going to the restroom, those things that you need to do on a daily basis. Oh, hygiene, helping them brush their teeth, whatever they can, so they could, stay on course in their lives.
Yeah, that's really good. I know with our home care agency here in the Tulsa metro area, we're helping people with a lot of that. We even have a client that was had a brain aneurysm, and then had a couple strokes, and from that had some speech issues. And so we even did some homework with that patient, and they got back a report from their speech therapist that they improved by over 40%. So there's also some other things I think that home care can do besides meal prep, making sure somebody's healthy, they're eating well. One issue my mom had, even when she had those wounds, is she had the wound care, right? And one of the things that was causing those wounds to show up and the issues that she was having is that she ate terrible food. She was drinking a big giant Coke every day. She was eating Fritos. She was eating Cheetos. Her diet was really bad. So I think home care is not just necessarily, oh yeah, we're going to get you some food. It's going to be, we're just very basic. But I think at the end of the day, if you really look at what's happening, you're making somebody's life more healthy because you're making sure they have good nutrition versus, say, just junk food. So I think that's super important too.
Yeah, for sure. Home care could surely encompass a whole lot of different things, within the home. And a good home care agency will kind of take a holistic approach into what they're doing for the family, whether it's, their social needs, their, how their nutrition needs, their physical needs, even their spiritual needs, and you're talking about, a nurse coming in, but the nurse comes in and comes out, and who's going to encourage them and cheer them on to do the things that they need to do within the rest of the day? A great caregiver would also be a good cheerleader, trying to get them to take the next steps to getting better too. So, yeah.
Yeah, that's true. That's so good. So who would typically even qualify for home health, and who would say a better fit for non-medical home care?
Sometimes they're one and the same. Because somebody that could qualify for home health would be somebody that gets a doctor's orders, has the proper insurance, and has an ailment that can get better. And once they have that ailment and the doctor decides that it could get better, the home health team could get into action to help them take those steps into getting back on their feet and the home health agency leaving. You know, so but the home care agency can go in there and do everything else while the home health agency's not there. You know,
Yeah.
so someone that'd be a good fit for home care would be somebody that maybe doesn't have somebody in their home all day long. Maybe their spouse works. Maybe their kids live out of state. They might have people that come visit them, but not anybody there specifically to help them during those off hours when a friend's not there, family's not there, home health aide or nurse is not there, or therapist is not there. Our caregivers can be there, so
Right.
you know, to help with all that other stuff.
Yeah. And so, how does the role of a caregiver in home care differ from the role of a nurse or therapist in home health? Like I mentioned just a minute ago, we have a patient. His speech therapist is. They are not coming to the home, right?
Yeah.
He goes out, he gets evaluated. Maybe they do some exercises, but then he goes home with some homework, right? And so at the end of the day, it's kind of left to him and his family to do that homework. And if somebody doesn't have the capacity themselves to really stay on track, right? I mean, if you're having some struggles with memory or different things like that, you may not remember to do some memory exercises or speech therapy exercises, right? So how does the role of a caregiver in home care differ from the role of, say, a therapist, speech therapist, memory therapist, or home health RN nurse?
I like to think of it as, you remember when we played sports when we were young? I know we were a little younger when we played
Yeah,
sports.
yeah,
If they would tell us for every hour that you practice, you got to be doing 2 or 3 hours on your own to get
yeah,
better, right? So that's kind of the case with the difference between the therapist, whether they come in or go out for therapy. They still have work to do when they get home. And like we were talking about, a good caregiver being a cheerleader. How do you get somebody to take care of themselves when there's not a doctor looking? That's what a good caregiver will do. And it's all going to be written up in the care plan. The plan of care could say, 15 minutes a day doing physical therapy exercises. It's in the
that's
care
good.
plan. Yeah, so.
That's good. And talk a little bit about the care plan. So you were talking about some of the things that could be in there.
Oh yeah, definitely. When you meet up with the client, you want to get a nice care plan in place. Make sure that they're getting all the care that they need. You may talk to a family, and the family will be like, "I just need somebody to sit with my father." But there's so many things that we could do, and having a great care plan is the beginning of it all. We want to make sure that our caregivers are engaged, they're helpful, they're setting the tone for what's going on in the home for this client to get better. Who doesn't want to get better? Shoot, I want to get better today. Imagine if you weren't doing too hot and you're in your home. We want to make sure that the care plan really kicks off what this whole experience is going to be about, right? It sets the tone for the care and for what the next 6 months is going to look like.
Yeah.
A good,
Yeah.
a good care plan and a good home care team, they might work themselves out of work, right?
Hey, that'd be a good thing, right?
Because with the physical therapy that they're
Yeah.
getting, the home care that they're getting back on their feet, having someone do the physical therapy, cooking for them and helping them and encouraging them, we could work ourselves out of work, that's for sure, if done right.
Right. That's awesome. Yeah, I think at the end of the day, also, a good care plan also will strategically work with, say, the home health side or geriatric care, or in this case, it's not it's not geriatric care; it's speech therapy care, right? So a good care plan can also include homework exercises for different things. If you have a family member that is struggling with, say, memory, for example, there's a lot of memory exercises or memory games that a caregiver can actually work with your loved one to do those exercises to help improve their memory. So lots of different things that could be in the care plan that can work with care providers at a higher level, at a higher capacity. So what happens when home health ends? So let's say somebody has home health, let's say it's wound care, wounds get better, they end up leaving, so now the family doesn't have that, RN nurse coming in, checking in on that family member. So what happens when home health ends? Where do you see families struggle the most after that?
Yeah, just keeping up with with the home health care plan. And just because the physical therapy is over, it doesn't mean it's time to be sedentary and just sit there. Stay active, keep moving. Just because the nurse is not there anymore, it's not time to start eating a bunch of salty things or dive into sweets. So the family has to continue with the nice care regimen that the home health has established. And for a good home care agency, usually if they're both there and then home health tapers off, hopefully by then they love their caregiver. They love the improvement they got. Maybe they're getting some communication with their physical therapist about how they exceeded, expectations on getting better, and and they could see how a caregiver played a part in that, right?
Yeah.
Or my mom loves my caregiver, and how do we fill the gaps from the home health not being in there anymore? Maybe adding a few more hours a week will help fill those gaps. We see a lot of that going on. Most of the time they want to keep their caregiver because of the bond that's been created over the few months of them getting back on their feet. So I see a lot of that.
Yeah. And so we talked on this a little bit, but how can, say, home care and home health work together? And what does that partnership look like when it's done right? I've talked a little bit about a case study of our home care agency, A Better Solution in Home Care here in Bixby, about how we work with some patients that had some speech therapy, right? Talk a little bit about how they can work together and what that partnership looks like.
Well, yeah, everybody working together, where it's the client, the family, the home health, or maybe the hospice, the home care agency, all working together, it really gets to get a different perspective on what that care looks like for the person, because you're getting different eyes on them at different times, right? Let's say you have a client and a home health comes in 2-3 times a week at 9 a.m. and the client is doing good, just woke up from a nice night's sleep, has a little more energy at 9 o'clock, is a little focused, has had his coffee, and the home health is like, man, he's doing great today. But come 3 or 4 o'clock, he gets tired, he gets a little weak, and the caregiver comes in and notices that, his blood sugar could be down, he's very tired, he's not ambulating like he was yesterday. So just getting an extra set of eyes on them is the main thing, and how you communicate that, right? Whether you have some type of online system, or you have a notebook, or you do phone calls, or even get as intense as being a part of their care conference within the home health agency. I've sat in with home health agencies and they've asked me how my clients are doing during their meetings, right? Because we share the same client. I'm able to sit there and give them some insight on what the other 23 hours look like during the day, right?
Yeah. That's good, because like home health, again, they may only be there for an hour, and so they don't have the full picture. So we can give them some insight into, they were coughing, or they struggled with a little period of coughing too much. Maybe look into that. There's things that can really prevent more tragic things from happening, or readmittance into hospitals, just by having home care. So, if it's something that the family can afford to, have home care there, it can definitely improve the quality of life. Yeah. So highly recommended for that. All right. So my next question is, from a family's perspective, how does the day-to-day experience differ between home health visits and having a home care caregiver?
Yeah. So, like we keep harping on, the home health visits are 1 or 2 a week, maybe 3 a week, and they're for 45 minutes to an hour. So most of the conversations between the family and the home health is going to be the nursing stuff. They're going to be talking about blood pressure. They're going to be talking about pain control. They're going to be talking about wounds. They're going to be talking about all the medical stuff that encompasses what that care looks like for the home health. Well, discussing what with the home care agency is going to be more like, is my dad eating properly? Is my dad clean? Is my dad's hygiene taken care of? What's my dad talking about today? What's the topic of conversation? How do you feel my dad is doing during the evenings? Is my dad starting to struggle during the night? Just all that other stuff, that happens during the day. when you go in 3 times a week for 45 minutes to an hour, it's like really taking a photograph of what's going on that day, right?
Yeah.
The caregiver and the home care agency might have like a video of what's going on, not like, like a real video, but they
Yeah.
got more of an understanding because they're there for such a long time,
Yeah.
being able to see the ins and outs and what's going on with the house. So that's kind of how they work. So
That's really good. Yeah. All right. So, what are some signs that a family might think they need home health, but actually need home care instead, or both?
yeah, and we get back to the first question is, they don't know which one is which, right? So they think home health is home care, and home health, their insurance will cover a caregiver being in there all day. That's not what's going on. A family that needs home care is going to be somebody are going to be a family that is worried about their parents falling, their parents rehabbing from a fall. Could be something that they worry about for home health, right? So maybe high blood pressure could be something that's more home health aligned with. Where home care agency is, how do I get my dad to eat nutritious food throughout the day so he doesn't have high blood pressure, right?
Yeah. Yeah.
So one's reactive, one could be more preventative, right?
Yeah.
So having a good caregiver in there that makes sure that dad is communicating properly, dad is enjoying his day, dad is eating nutritious food, dad's hygiene's taken care of, dad's ambulating around the house and moving around and not losing all his muscle. Like, that's all home care stuff, right? That could be all preventative, right? Like, I want people to call me when they're not in an emergency. I want people to call me before they're, so their dad doesn't go and break his hip. Like, those are the calls I want to get. Families that are have been prepared, put money aside, or have a plan to make sure dad doesn't end up in the hospital all the time, or mom doesn't end up with memory issues because somebody's there making sure she has a nice diet and she's doing brain function stuff to help her.
That's good. That's good. So, if a son or daughter is listening right now, and they feel a little overwhelmed and they don't know where to start, what's the first question they should be asking?
That's actually a really good question. The first question they should be asking is what the next 5 to 10 years may look like for my parents, right? When your parents retire, usually when they retire, I'm not saying that they lose purpose in life, but they're a little less active. They don't use their brains as much. They're enjoying themselves, and whatever retirement will look like, depending when they retire. Shoot, people could retire and be on a beach, be surfing. The retirement looks different. But like, I know from the time my father-in-law retired, things started just kind of get slowly getting worse and worse for him. And really, the question they should be asking them is, what do I want my parents' future to be like as they age?
That's good. That's good. So, at the end of the day, I think there's a lot of good things that come from home health. I think there's a lot of amazing, great things that come from home care, but neither one really do the other, right? And so there's some really clear things that happen on the home care side versus, say, home health.
Yeah.
And at the end of the day, if you're a little unsure, reach out to a home care expert. My agency, A Better Solution in Home Care. If you're watching this, you can reach out to us. We're here for you. We can help you with any questions that you might have when it comes to, do I need home health? And we have a lot of partners here in the Tulsa metro area that we can connect you with, right? If you're a little unsure about that, and they can do an evaluation. If you're a little unsure if you need home care, our company, A Better Solution in Home Care, that serves the Tulsa metro area, we can also come out and do what's called a home care assessment. We can figure out what kind of care you might need, how many hours we might recommend that you guys need. So if you're a little unsure, you can always reach out, and that's what I recommend. I think, for the longest time with my own mother, I thought I can do it, right? And I felt like it was the right thing to do, that only I can do this, I will bear this burden because it's the right thing to do. And that's wonderful. I think people should step up to the plate to do that. But I think at also the end of the day, I was also married, right? And my wife wasn't getting the same amount of time with me, and she needed that interaction with me. I have other things, other duties, businesses, right? And so at the end of the day, I think we have to understand that as people, we can't do it all, right? So if we're unsure, don't get stuck in quicksand and be like, well, I don't know what to do, so I'm going to do nothing. That's probably the worst thing to do, right? At least ask, look for answers. It doesn't mean that you're weak or you don't know something or you don't have the insight. No, what it means is that you are aware that something needs to be done, but you just don't know what it is. So now take that extra step and go find somebody. It's kind of like this. It's like saying, well, I'm not going to, fix my teeth and cavities because I'm not an expert, and I don't want to reach out to somebody that's an expert. Like it'd be the same thing, right? So we all go to the dentist when we have a cavity or we have pain, and we get it checked out. So if you're feeling overwhelmed or questions or question marks are coming up, I recommend reach out to somebody in your space, in your sphere. You can reach out to us. We're here for you. And start asking some questions. The people that are experts are going to be able to answer those questions and be able to help you out. So thank you so much, Gus, for being on today. If you wouldn't mind, just share a little bit about how people could get in touch with you if they wanted to reach out to you, if they had questions for you. I know you're out of Wichita. Yeah. Share a little bit about how they could reach out if they wanted to.
Yeah, I love talking home care. I think I told you how much I love this industry. If you just want to have a conversation one-on-one, you could just call my cell phone, 316-500-4268. If I'm not available, call our office, 316-295-3282. I have an amazing team. Also, you can find us online. You could Google us. This is a good way to get a hold of us. But, I'm really grateful to talk about this subject with you today, Jeremy. I really do, man. Appreciate you.
Awesome. Same here. And so thank you for being on today, Gus. We really appreciate you. And then if you're listening, and like I mentioned just a minute ago, if you feel like you have some questions, we're here for you as well. Again, my name's Jeremy, and I'm with A Better Solution in Home Care. And I'm so excited that you tuned in today for the Tulsa Senior Compass podcast. We appreciate you. If you have questions, feel free to post them in the comments or chat if you'd like. You can also reach out and go to our website, tulsaseniorcompass.com. God bless you. Have a great day.
Bye, y'all.